Okay, so here I am talking about the role of surgery in cancer prevention. Risk-reducing breast surgery may be considered for those with strong family history of breast cancer, more than 20% lifetime risk, as defined by proper risk assessment and adverse genetic mutations, such as the BRCA1 or 2, and there's others. All right, so if a woman is identified as at risk, this is the first thing, simply because you find that because your genetics, you are twice as likely to get cancer, that is not important. You need to let people know. That doesn't mean they're going to get cancer. Cancer is not a guaranteed thing, okay? But there are people who are predisposed, or there could be, those mutations, those oncogenes that are found, which indicate that a problem is quite likely. And so we have surgery possible that's available. Mastectomy can reduce risk of breast cancer by 99% if they've also had an oophorectomy. All right. 90% if they have intact ovaries. 90% reduce in risk of having breast cancer by doing the mastectomy. And next, they found that you can spare the nipples and have nearly the same benefit. All right, you can spare the nipples, and it's more cosmetic. So that's potentially life-saving. And the oophorectomy is there with the details. So before I leave this, I just wanted to mention that it's recommended that women do this. Oh yeah, there it is. Right after finishing having their last child. So the point is that the earlier you do this, the better. There's a cumulative effect of having the problem and not dealing with it. So the earlier you have the mastectomy or nipple sparing risk reduction mastectomy, the earlier the better. Of course, you need your breast for breastfeeding, and breastfeeding also, it prevents, it's cancer preventative. But yeah, sooner the better with this prevention. Don't wait till too late. Don't wait till late stage cancer to start treating. I covered that. Next, endometrial uterine cancer. If the person has a heredity, for example, LS, Lynch syndrome, hysterectomy is available, bilateral oophorectomy. These are low-cost ways to improve quality of life. There can be minimally invasive surgery. Patient can be discharged the same day. This is sounding pretty good. This is not like your weekly chemotherapy, with making plans for passing on. This is a very nice way to manage and risk reduce. So it should be said that comorbidities need to be considered. And so people who are not good surgical candidates maybe shouldn't take the risk of a surgery if it's possible that they might die on the operating table or soon after. Anytime within the first month is considered a failure. And so here is RET mutations as a gauge for risk of medullary thyroid carcinoma. Babies can be considered, and young children. So babies that have the RET mutations, babies in the first year of life, they can have a risk-reducing surgery. And with type 2, level 2, ages 5 to 6, level 1, low risk. It's okay to wait till a child is 5 or 10, but have that surgery when they're young and prevent a possible cancer. It's terrible when a child develops cancer and dies young. Heart-wrenching. For polyposis, adenomas, polyps, surgery can reduce risk of colorectal cancer. So with the case of less than 1,000 polyps and less than 20 adenomas, you can have total abdominal colectomy, ileorectal anastomosis. Proctectomy is an operation available for those presenting with more. And this is to prevent colorectal cancer. With cervical precancer, there's cryotherapy, conization, and electrosurgical excision. If available, that's high tech and requires a lot of training. So it might not be available near you. But if you're going to prevent, why not travel to get it? Bariatric surgery, last, I added to this, it was not mentioned in the article from our text, but I added it here. It might reduce risk because it is reducing the obesity. So to conclude, we can strive to prevent cancer by treating precancer and early cancer with greater success. Healthcare professionals need training and education to be able to educate patients in public with resources. And here's an example of a simple resource: not smoking, healthy diet, breastfeeding, vaccination, avoiding too much sun, reducing pollution, being physically active, limiting alcohol, screening, all right? Simple resource, easily accessible. We should take cancer risk factors into our locus of control, take responsibility for our lifestyle, as well as the environmental factors that we can change. A multidisciplinary approach is next recommended to address addictions. Tobacco, very addictive, drug use. Let's get the multidisciplinary team working on this. Next, regular screening is suggested for cervical. It's between ages 21 and 65. Regular screening is recommended for colorectal between ages 45 and 75. Breast cancer screening is recommended in general, recommended for ages 50 to 74. It's possible for people outside of those age ranges to get screening and benefit. This is just a comment saying that it is generally recommended for all people of those ages. So of course, it's all women getting the cervical cancer and breast cancer checks, all people getting colorectal. Those at high risk for certain forms of cancer should be checked more frequently. This is the next takeaway. I mentioned some of the mutations that can be found. Often if there's cancer in the family, running in the family, that might indicate that there's some genetic reason behind that. And then there's an example of the behavior. So the smoker is more likely to have the cancer. 1 in 2 smokers die of cancer, of lung cancer. And so we can screen them between ages 50 and 80. Regularly screen. Don't wait till it's late stage cancer to deal with it. Get it early. So starting from age 50, even a smoker who has quit in the last 10 years, unless it's been more than 15, go ahead and get the screen. Starting at age 50 and treat it early. If there's a family history, genetic counseling is a next step. There's a counseling, and then if indicated, genetic tests can be connected. Again, if indicated, there can be regular checks or even preventative surgery. If the lifestyle changes and environmental changes are not enough, surgery and the early treatment. Last, we can educate people about cancer symptoms to facilitate early detection. So for the sooner the better. Sometimes every day counts. Every week is a matter of life and death. And so as soon as there's a sign of weight loss, pain, nausea, diabetes, itching, fatigue, dysphagia, a mass, as soon as you feel, right away. Don't wait till it metastasizes. Right away. Treat as soon as possible because the treatment is more likely to be successful. Thank you very much.